So Bev, remind me again the first and second floors at this nursing home, because they're different.
They are. So yeah, yours is ground, then upstairs first, which is dementia unit, which is actually divided into two. So you've got two different corridors which are closed off from each other, because some of the dementia is more advanced. Then you go up to the second floor, which they do have dementia, but it's more for challenging people with mental health issues, but they use it as a challenging unit. And again, it's split into two. So those that are perhaps mental health but more manageable, then you've got your other unit where it could be even more challenging. So it's very well divided and very well cared for, and they do move residents around as they feel people perhaps are less well and they're calmer, so they may sort of start bringing them down floors, and you'll notice that even on your ground floor that you may get someone that's frailer and poorly because they don't need to be in that environment. So that's how it works.
Then the ground floor, the one that I go into, that's your sort of elderly, frail residents, and that's where I was today. And it's been really nice to go back. The two patients that I saw there, I think just having that presence in the care homes for them to know that the care home support team are still coming in, that Eleanor is still around and coming into them and seeing them. So yeah, just leaving the patients with that sort of knowledge that the service is still there.
Reassurance.
Absolutely.
And for the GPs that like to know we're still out there.
Yeah, absolutely. And the staff in the care homes, all of them really. So I've been, I went on the ground floor, and it's all a bit different going in with COVID now, with all the social distancing and masks. I went to see a patient who was a crisis patient. They told you about him last week when you were there. So I went in and saw this gentleman. Again, it's a little bit different when you've got masks and you're speaking to the patients, but it's, our assessment's the same as it is before, really, just sort of
the patients stare at you, don't they, like, what?
Yeah, it's a bit strange. They must be getting used to it with the staff and everything, but it is different. But it means that we can still carry on going in and seeing those patients that we need to, as you said about your assessment patients, so going in and seeing patients for first assessment and crisis. So the two patients I saw on the ground floor at that care home today, they were both patients that are deteriorating, and the staff wanted us to come in. All the patients that are on that unit that are stable, I didn't go into their rooms and see anybody. The nurse and I spoke about them, and I think going forward that's the more sensible thing to do. There's no need for us to go in and see those patients that are stable. We can either speak to the nurse while we're there or speak to them on the phone, but continue going in for the ones that are poorly and that need assessment. And then you went up.
Yeah, then I went up second floor, and I went to do one assessment and ended up doing two, which was really good, purely because one of the patients that I was aware of that was new suddenly appeared from nowhere, delightful, wanted to chat, so it was an opportunity to find, and I thought, good timing, find out more about him, wrote as much as I could, and then went and found the one that I'd actually gone to see. And as always, it's lovely up there. You've got to sort of run behind them to keep up with all the patients, and got all my information, mainly, personal stuff, about their day-to-day activities. Caught up with the team leader up there. No concerns, no worries. So again, I didn't go around and see the others. I know it's not the same. I miss it terribly because they look at you like, why haven't you said hello? You always say hello. And I do shout, I'm very good at shouting, we all know that. But it's not the same. So, but anyway, so I left the unit and then come down, found you, and then we left.
But I think it's good for the staff. We're going in and doing what we need to, but we're not on the units or in the care home unnecessarily. So it's just balancing out that risk of when we do need to be there, but not being there sort of unnecessarily to sort of
tie them down, do we really?
Absolutely.
Keep the staff from their work. But
so
at least we're out there, at least we're back out, which is nice. We're seeing patients, meeting with staff, keeping everything up to date. And then
And I think it's nice for the staff as well. There's only so much they can tell us over the phone when patients are poorly. I think it is different when you can see them yourself and do a face-to-face assessment. That's very different to trying to assess somebody over the phone. I think the staff in the care homes appreciate that as well. They're quite glad, or at this care home.
We've got to do our best to
Absolutely.
keep it going.
And provide the care that the patients need.
Yeah.